Dear students, welcome back. In the previous session, we have discussed about deviations from optimal alignment, anterior and posterior views, and also the scoliosis, isn't it? Now, in this session, we are going to discuss about effects of age, gender, and also during pregnancy, and due to some occupation, the posture is going to deviate. Okay, now we will see what are the effects of age, gender, and on posture. Now we are going to discuss. So, if you come to age, if you see infants and children, postural control in infants, that is below 1 year of age, okay, develops progressively during the first year of life from control of head, okay, next to control of the body in sitting posture, to control of body in a standing posture. Okay, so stability in a posture or the ability to fix and hold a posture in relation to gravity must be accomplished before the child is able to move within a posture. Okay, so the child learns to maintain a certain posture usually through contraction of agonist and antagonistic muscles around the joint, and then is able to move in and out of the posture, that is sit to stand like this, and stand to sit. So once stability is established, the child proceeds to controlled mobility and skill. Controlled mobility refers to the ability to move within the posture. So here you have to remember that controlled mobility refers to the ability to move within the posture. So that is weight shifting in standing posture. Okay, for an example. And skill refers to performance of activities like walking, running, and hopping, which are dynamic postural activities. Okay, and some of the studies have performed by some investigators. So by the time a child reaches to 7 to 10 years of age, postural responses to platform perturbations are comparable to adults in pattern of muscle activity and timing responses. They found considerably less variability in postural responses to platform movements in 7 to 10 years old than was present in younger age ranges. And they have also predicted that responses of the younger children included greater co-activation of agonist and antagonist and slower response time for muscle activation than adults or older children. Postural alignment in children should be similar to that of adult alignment by the time the child reaches to 10 or 11 years of age. However, poor posture in 7 to 8 year old can be recognized because it is almost similar to the adult. Okay, so that is kyphosis, excessive anterior pelvic tilt and accompanying lordosis, forward head movement, and also hyperextended knee. So this is the thing here. The child is performing such kind of posture. Here we can find anterior pelvic tilt and also kyphosis and a forward head and somewhat hyperextended knees we can find here. So this is such kind of poor posture we can recognize in children or 7 to 8 years of age. When we compare with the male and females, in males a degree of kyphosis at the age 14 is predicted, and the development of hyperkyphosis at the age of 22. which was found to be 10 times more prevalent in males than in females. In females at 22 years of age, the mean lumbar lordosis was significantly more pronounced than in males. Okay. So, and also deterioration of postural control accelerated at about 60 years, and the decline with age was more prominent in males. Okay. Normally, postural balance which are going to decrease from the ages of 30 to and 80 plus years. Okay. Yes. So if you see, this is about the age and as well as gender. And if you see elderly separately, so postural responses for older people, here you can see the posture of young ones and with that of the older ones. There is a lot of difference we can see in the posture. So the postural responses of older adults ages 61 to 78 years to platform perturbations shows differences in timing as well as amplitude, and include greater coactivation of antagonist and agonistic muscles when compared to younger subjects. Okay. And they have studied so many studies, and finally they summarized that postural alignment in the elderly often shows a more flexed posture than in younger adult. Okay, so the typical elderly posture is probably due to a number of factors. Either it may be the aging process or to a sedentary lifestyle, or to combination of aging and sedentary lifestyles. So changes in the vertebral column such as loss of fluid from the vertebral disc and degeneration of the discs and vertebral bodies causes an increase in the normal thoracic curve here, and that results in shortening of the trunk flexor muscles and lengthening of trunk extensors. The head is often forward, which causes an increase in flexion in the cervical region and increase in the extension at the atlanto-occipital joint. And the range of motion at knee, hips and ankles and trunk are may be restricted due to muscle shortening and disuse atrophy. Okay, if you see some more about the postural response in the elderly appear to be longer than in the adult. The elderly may elect to stand with a wide base of support to have a margin of safety. So here you can see the graph. The cervical lordosis have been checked from ages 20 to 30, 21 to 30 years and 41 to 50. Actually this one is 31 to 40 here, and 41 to 50, 51 to 60 and 61 to 70. So in all these years you can find the cervical lordosis is gradually increasing here. Okay, so this is about the changes we can see in elderly people. Now we will see changes during pregnancy. Yes, here is a pregnant woman. You can see here. You can observe the postural changes. The postural changes in pregnancy include an increase in lordotic curvature, and we can see in the lordotic curvature not only in the lumbar region as well as in the cervical region, and we can see this protraction of the shoulder girdle, and we can find the hyperextension of the knees. So these changes are caused partly by the combination of weight gain and an increase in weight distribution. So normally during pregnancy, the weight is going to increase at the abdominal level as well as in the breast. So the weight distribution in the breast as well as the abdomen is going to increase. So normally, as we know that the center of gravity, we have already discussed in the basics, that center of gravity is going to, if more segments are present, if center of gravity shifts towards the where the weight is more, then that segment that part will have the shifting of this COG. For example, if you take two equal parts of the segments, so then COG lies at the center. Okay, if you take two unequal parts, so one is very small and another one is big, so then the COG shifts towards the greater part to maintain the balance. Okay, like that. So normally, as we know that at the anterior portion of S2, the normal COG is present. Now the COG is going to shift towards anteriorly. Once the COG, the line of gravity falling anterior to this, then what will happen? Ma? So there is which causes anterior pelvic tilt, which causes anterior convexity of the lumbar spine, isn't it? So this lumbar spine causes increase in thoracic, which finally leads to the cervical lordosis. So such kind of things are going to take place. Okay. And why these things? So when one cause is weight gain and an increase in weight distribution in the breast and abdomen, and partly to the effects of softening of the ligaments and connective tissues that accompanies pregnancy. Okay, these are the changes predispose the pregnant woman to strains in supporting structures. Okay, so the investigators found changes in the lumbar angle, head position and anterior pelvic tilt. The lumbar angle increased by an average of 5.9 degrees. The anterior pelvic tilt increased by 4 degrees and the head became more posterior as pregnancy progressed from the first through the third trimesters. So these changes in postures, why all these changes are going to occur? So these changes are going to occur to represent adaptations that help to maintain the center of mass over the base of support. So that means these compensatory changes for the increasing weight distribution, which shown on the vertebral column as well as hyperextended knees, because these compensatory changes adjust the COG. That means the line of the LOG should fall in the base of support. Okay, so for that reason, these changes are occurring during pregnancy to maintain stability in the erect posture. Okay, so softening of these ligaments and connective tissues, especially in the pelvis, sacroiliac joints, pubic symphysis and abdomen, change the support and protection offered by these structures and predispose pregnant women to strains in supporting structures. So because of all these changes, many women experience backache during pregnancy, and all of the women in the study by Franklin and Connor complained of backache because of all these structural changes causes that woman having back pain. Okay, so as a citizens, we should consider and we should show concern towards the pregnant women, and if possible, kindly help them whenever they are needed. Okay, and next one is the thing Occupation and recreations also changes in the posture, causes some deviation. Each particular occupation and recreational activity has unique postures and injuries associated with these postures. Somebody like surgeons, carpenters, and cashiers, some people who are performing tasks in standing posture. um, uh, you can take housewife, okay, who works all the day, all the time. We can take them under this category in standing postures for a majority of working day. Okay, and others such as secretaries, accountants, computer operators, and receptionists assume sitting postures for a larger portion of the time. So, and also performing artists often assuming asymmetrical positions while playing a musical instrument, dancing, or acting. And if you go for a sports person, running, jogging, and long distance walking or dynamic postures with which very specific injuries are associated here. So for standing postures for a long time, they are going to experience some compression at the pelvis as well as knee and ankle foot deviations we can find during sitting postures. The person will have some deviations at the cervical as well as the lumbar regions. Okay, there are many conditions we can identify regarding the occupation, and for these people they are come under occupational injuries, and the recreational activity injuries will belong to the category of overuse injuries, because they will use only one type of posture during their work throughout the day. That is the main cause for the overuse injuries. In this overuse injuries, one part of the body is going to be lengthened and another part of the body is going to shortened. So definitely which leads to overuse injuries. So this is all about the effects of age, gender, pregnancy, and occupational and recreational activities. In the next session we are going to discuss about gait. Thank you.